Good morning. Our offices have been retained by the Mitchell Robinson family in reference to bringing civil action against DCFS and any other entity that we believe is responsible for gross neglect. This is an awful tragedy that took place, and there were signs that were given to the proper reporting agencies, and yet these signs have gone ignored. Frankly, that Mr. Robinson, the 2-year-old baby that had his whole life ahead of him, should be here today. His mother was suffering and is still suffering from the disease of addiction. DCFS was put on notice of this, and yet nothing happened. Not one overdose, not 2 overdoses, not 3, led to any intervention. Then tragically, he was gone. This has to stop. We're here today in memory of baby Mitch. However, this is for all of the children that have been affected by the gross negligence of DCFS. This is not a shot at the individual social workers. Being a social worker oftentimes is a thankless job. However, we believe that the social workers in this case and in other cases that have permeated both in the news and not in the news are basically working with their hands behind their back. Meaning that the policies that are in place up top make it very difficult for them to do their jobs in situations like the tragedy with baby Mitch happens. In speaking with the family on yesterday, the number one thing that they wanted was change. Change. They want to make sure that baby Mitch's memory is not just a 2-year-old who died of a fentanyl overdose, but that his death will be a watershed moment, that the state of Louisiana steps up, DCFS steps up and makes substantive changes to close in these loopholes to make sure that this does not happen again. This morning prior to the press conference, I spoke with State Rep Denise Marcel. Ms. Marcel and I talked for about 30 minutes about the DCFS case and in particular baby Mitch. She's going to work with us collectively to introduce legislation in baby Mitch's name to make sure that this does not happen again. At this time now, I'm going to give it to my co-counsels, Christopher Morrell and David Utter, to speak, and then we'll open it up for questions and answers.
Thank you very much, Ron. You know, I remember well the call from Ron about this case, and it just reminds me of 30 years ago when I was in Louisiana working on juvenile justice reform. And it's not a good memory, right? I mean, I don't know what it is about this state that continually fails to protect kids. And this is a cycle, right? When you don't take care of 2-year-olds, you're going to see them in the juvenile justice system, or you're going to see them in the criminal justice system. And it's just, you know, tragic and outrageous and really, really frustrating to come back to this state for something like this again. And I wholeheartedly agree with Ron. You know, we've got to turn something good from this tragedy. Thank you.
Oops. Oh, sorry. Do I just... The way in which DCFS has decided to structure its department, due to being underfunded by our state legislature, due to having apparently the support of our governor, dictates its own failure. DCFS workers all have a caseload that is far, far, far above the national average. They're asked to see 30 children a day sometimes, visit 30 houses a day. And when a child doesn't get seen, when the child's number 30 on that list, he doesn't go to number 1 the next day. She doesn't go to number 1 the next day. She just goes to the next month. There are kids that just don't get seen. The whole DCFS model they've adopted, that they implement, is to get social workers in who are well-meaning people who think we're really actually going to be able to change this, and then get put in these conditions and burn out and leave in 2 years. That is, they have DCFS, our state model, has adopted a policy, and morale is horrible at that department amongst the workers, amongst the people who are supposed to be supervising the children. Our state, because of the underfunding, because of the way that agency is run, has decided to create situations like Baby Mitch's. This is completely foreseeable. We can remember just not too long ago, there was a capital case here in Baton Rouge where a child showed up in a hospital with a broken leg. DCFS was intervening. DCFS allowed the child to go back to the house where he was in, and the child was murdered. This is not a unique circumstance of these failures. It happens over and over again. There's a press cycle like this, but our governor, our state legislature, they ignore it, and that's what we're demanding out of this lawsuit. What we are demanding out of this lawsuit, what we are seeking out of this lawsuit is change, reform, and having an agency that actually protects children. As David said, when you grow up in a home with drugs, when you grow up in a home with abuse, when you grow up in a home with neglect, all of these things are the red flags that precipitate juvenile crime, that precipitate our crime wave we have right now. And we should absolutely, in the state and through this litigation, we hope to make the state start spending the adequate money to take care of these children, to save the money down the long road, save the money down the road, save the money on incarceration. Like, help the kids, get them in a position to succeed. Thank you.
We'll now open up for questions.
I have a question. So I know you mentioned you had a conversation with the family. How have those conversations gone, and what has been the topic of the conversation and the focus of those?
Change. They feel that the department absolutely failed them. They feel that the department absolutely failed Baby Mitch, and they want Baby Mitch's legacy to be more than just a kid that died in 2022 of a fentanyl overdose. That they want what happened to him this summer to be, again, the watershed moment that effectuates real change so that another Baby Mitch does not happen. That has been the main focus. And the focus on the mother and getting her better. Listen, I don't know, for those of you guys who were in court yesterday for a bond hearing, I mean, it was pretty jarring to see how her body has physically handling withdrawal symptoms. And she's been in there over a week and is still in pretty bad shape. And so they're concerned about getting her the adequate help so that she can eventually be a productive member of society and that she can get healthy. But those are the two main things they're worried about: the health of the mother and getting change for Baby Mitch.
Yesterday, the defense attorney said, Whitney Ard is also a victim in this case. Do you view her as a victim as well?
I do view her as a victim. She suffers from the disease of addiction. This case is not like the one that was recently on the news where the mother and grandmother gave a child alcohol until that child died of alcohol poisoning. This is a woman that is suffering from addiction. Addiction is a disease. I thought her defense attorney spoke well on it in speaking, listen, this opioid epidemic is very similar to the crack epidemic that happened in the 80s and 90s. However, during that time, it was thought that you're just going to throw addicts in jail and lock away the key, or throw away the key. Now we are hopefully, we have learned that that wasn't a good thing, and that we need to focus on treatment and getting people help. So yes, I believe she's a victim of the disease of addiction, and I believe that DCFS also failed her, that there were things that were put out there that was obvious that this woman was suffering, and yet there were no programs. There was no, listen, the name of it is the Department of Children and Family Services. Where were the family services offered to this family? There weren't any. And that cannot happen again. It can't. And on our watch, we're going to do everything that we can to ensure that it doesn't.
What do we know about how the department actually interacted this family once they got these reports from the hospital? Did they visit baby Mitch? Did they visit the mom? What did they do?
We still haven't gotten those reports yet to know exactly what happened. We know it didn't happen. We know that baby Mitch wasn't taken away from the home and placed in the care of another family member.
And did the family file reports as well? The grandmother, there was something about that in your press release yesterday.
Yes, in 2021, the paternal grandmother did notify DCFS of possible drug use and drug abuse on the mother's part.
What did DCFS do in regards to that? Did they reach out to the grandmother? Did they make an appointment to see the mother?
We don't know yet. But again, we do know that based on the tragedy that happened, that baby Mitch was not, there was no, at no point in time we can say this, there was any intervention that baby Mitch was taken away from his mother for these reasons for any type of interval time. That's the one thing we can say.
Do you believe that DCFS is the most responsible person in Mitchell's death?
Yes, I do. If this would have been a case where this was the first incident that took place and it's just a tragedy inside the house, that there was no other reports to DCFS, that they would not have been notified of the mother's drug history and drug problems, and there was no other situation where the kid had gotten a hold of drugs, then no, they would not be the appropriate person to point the finger at. But again, we're not talking one time. We're not talking 2 times. We're not talking 3 times. We're talking 4 times. It took past strike 3. And then baby Mitch is gone.
And let me be clear about, we know we are not trying to trivialize how hard being a social worker at the DCFS is, how the caseloads they have, the burdens they have, the responsibilities they have. We in no way are trying to say these people who are out in the field with the best hearts and intentions are doing something wrong and failing intentionally. They're understaffed, they're underfunded, they're overloaded. The DCFS has structured itself to make sure its employees cannot succeed in protecting children. The DCFS has structured itself to burn their employees out and hire new ones 2 years later. The DCFS has structured itself for cases like this to happen. And the agency is responsible. We're not trying to say this is a rogue social worker. This is a systematic problem, not an individual one.
I was just going to note that, one possible intervention would be to get mom treatment, right? I mean, DCF has 2 different sort of roles here. The most important one is to protect children. But after that, it's to reunite children with their family, and you only can do that if mom gets treatment for this disease of substance abuse.
So at a Senate committee meeting this week, they said that, one of their biggest hurdles is lack of funding. That's why they can't keep enough staff on. That's why the few that they have get overloaded with these cases, get burned out, and leave. So other than, increasing their funding, what are some of the other things that they could be doing differently? Because it seems like that's the big thing that's holding it all together.
I mean, I don't think there is anything but increasing their funding. Like, you can't take care of the children who are in need and in danger in our state. You can't ensure their safety, that they won't die. You can't ensure they won't be neglected or sexually abused if you don't have the resources. There's no shortcuts. The legislature needs to allocate more money to DCFS. The legislature needs to change the structure and supervision of DCFS. There needs to be accountability. There needs to be transparency. People need to be able to see what is happening, and we need to be able to see, whether it's through some kind of court monitoring, whether it's through legislative monitoring, make sure that the money is being put to the right uses, make sure that these bureaucracies and infrastructures are actually working the way they should. But the short answer is, if any legislator, if our governor is serious about protecting Louisiana's children, the only way to start this is with more money.
I would also encourage the state to look elsewhere for other models that work. Right? We did this back in 2003 when the juvenile justice system looked at Missouri. There are states that do this well. Let's not reinvent the wheel. Let's get somebody in here that can evaluate the system and change it based on best practices.
Are you aware of any policies that need to be changed or could have prevented this or led to this?
I think funding is a big part of it, right? I think Chris said it well, that sometimes they are forced to see 25 to 30 kids a day. If you don't have more social workers out in the field, that part of it is not going to change. So on the basis of putting caps on how many kids they can see, make it closer to the national average. Right now we're at triple the national average. I think that's a starting point. Also, we need to expand the mandatory reporting. Right, it has to go beyond just DCFS and the hospitals. That I know schools have to report, but we need to see who gets in touch with these children first to notify and to observe this abuse, and then what are their roles at, and immediately reporting to DCFS.
What sort of legislation are you envisioning that would change the system that you talked about with Denise Marcel?
I think number one is the increase of funding. I know we keep on going back to that, and it sounds like we're beating a dead horse. But listen, you could put all the policies in place. We could have all the great ideas. But if we don't have enough foot soldiers on the ground, we don't have enough social workers to adequately help these children, it's just words on a piece of paper.
Do you think it's a mixture of just not only having enough social workers and the money, like you said, but do you think there needs to be better accountability from the top down at this agency as well?
100%. Listen, leadership starts at the top and trickles down. And the failures of DCFS, you have to look to the top of the food chain in this case, because these problems aren't new, right? Like Baby Mitch is not a new case. It is just a case that's making the news right now. But what we are going to do, us collectively, is that we're going to make sure and do the best of our abilities that Baby Mitch is the last case that we have in a press conference about this about.
And this problem is endemic in this organization and the way it's been structured for so long. It's not just having enough social workers, it's having social workers who have morale, who are paid well, who stay at the agency. Right now, with 3 times the average of number of cases, with 30 houses to visit a day, DCFS knows what it's doing. It knows, it sees its turnover and its employees. They are making the deliberate choice that this is the model we're going to employ because we're underfunded. We're going to pay people poorly. We're going to give them too much work. These really idealistic people who think they can change the system are going to come in, burn out, and leave, and then we're going to get somebody new. The problem in that's twofold. Number one, while they're there, the social workers can't do their jobs because they have too many cases. And number two, you lose all your experience on the ground. The only stability in DCFS are in the upper levels who continue to fail the lower levels, who are the people who are actually going to be protecting Louisiana's children.
Chris, you mentioned the need for transparency around all of this. DCFS's response anytime a child dies like this is we can't talk about it, we can't answer, all of this is locked in a black box. I mean, is that something that you could address through legislation? Is that something you expect to come out through the course of your lawsuit? Like, how can we get answers on how DCFS is handling these cases?
So I think it's, we fully understand and believe juvenile records should be confidential. We're not trying to create an exception for that, but what shouldn't be confidential and what should be transparent, whether it's through amending our Public Records Act law, whether it's through new reporting requirements, is we should know, and anybody should be able to find out when they want, how many social workers are there for each parish, for each area, how many families are they supervising every day, how many times. You don't have to have the family's name, you can have it redacted, but how many times are families actually getting visited every month? Like, we absolutely don't want and fully understand all the reasons for confidentiality, and that needs to continue, there's no question. But there are absolute ways that we can have accountability. Like, we don't need to know the names of the families to see a family only getting visited once every 3 months. You can see a family's only getting visited once every 3 months and know that's a problem. You don't need to see the names of all 30 families a social worker is supposed to see in a day. You can see that she's supposed to see, or he's supposed to see, 30 people in a day. And you'll know that that's a problem.
So, has the lawsuit been filed, and who is the main focus of the lawsuit?
We have not filed yet. Right now, we're exploring between state and federal court which would give us the better remedies in terms of being able to cure these injustices and actually prompt change. As soon as we figure out it will either be in state court here in East Baton Rouge or in the Middle District. As soon as we make that choice after doing some more research and evaluation, we'll obviously let y'all know.
And just to kind of piggyback on his question, and I think once you do file, is DCFS going to be the main focus of that, or and going to be anybody else listed in that suit?
Again, it's going to depend on the jurisdiction that we file in. The defendants you name in federal court versus state court are just different because of certain constitutional immunities and certain procedural vehicles. And so the short answer is whoever the named defendants are, the focus is on DCFS and its supervisors. And the people who are not, the problem is not the social workers who are working too many hours every day and assign too much work. The problem is their supervisors and then the people above them, as well as even the people at the top, even if they have the very best intentions, don't have the resources to put it back down. But DCFS as an agency and the way in which, and the positions in which it puts its employees is the focus of the lawsuit, not that one employee in specific wasn't doing his or her job.
Thank you very much.
No, thank you guys.
Yeah.
Thank you.